If you're over 70, there's a good chance something in your medicine cabinet is quietly working against you, not helping you. I'm talking about drugs you can buy without a prescription, cheap, common, trusted. And one of them, taken every night by millions of older adults, has been linked to a 54% higher risk of dementia. Here's the part most people miss. It's not the drug alone. It's how your body changes after 70. And later in this video, I'll show you the one mistake that happens at night, the one that leads to falls, hospitalizations, and sometimes never fully recovering. I'm Dr. Robert Anderson. I've spent decades working with older adults, and I can tell you this with certainty. Most medication problems I see aren't from rare drugs. They're from common ones used the wrong way for an aging body. Because after 70, your physiology changes in ways most people, and frankly, many rushed appointments, don't fully address. Your kidneys filter slower, your liver processes drugs less efficiently, and your brain becomes more sensitive to certain chemical effects. So a dose that felt normal at 55 can become dangerous at 75. Let's start with one of the most widely prescribed drug groups. Medications like Xanax, Valium, and Ativan are often given for anxiety or sleep. And yes, they work. That's exactly why they're so widely used. But in older adults, they don't leave your system the way they used to. Your liver clears them more slowly, so they build up in your bloodstream. Now picture this. You take a pill at 10 p.m. At 3 a.m., you wake up to use the bathroom. You feel awake, but your coordination isn't. That's how falls happen. And falls aren't minor events. They are the leading cause of fatal injury in adults over 65 in the United States. But there's another layer most people don't notice. These medications also affect how your brain processes information. Memory formation slows down. Attention weakens. Decision-making becomes less sharp. Even if you feel normal, your brain isn't functioning at full strength. Have you ever felt slightly off balance at night and just blamed age? That's often not aging. That's medication. And if you're taking one of these, never stop suddenly. Withdrawal can be serious. This has to be done gradually with your doctor. Now here's where things get even more surprising. One of the most dangerous medications on this list doesn't require a prescription. Diphenhydramine. You know it as Benadryl. It's also in ZzzQuil, Tylenol PM, and many nighttime sleep aids. Millions of people over 70 take this every single night. Because it's over the counter, it feels safe. But it's not, especially for your brain. This drug blocks acetylcholine, a key neurotransmitter your brain uses for memory and learning. Block that night after night, and the brain starts to struggle. Long-term research has shown that people who regularly use these types of drugs have a significantly higher risk of developing dementia. And here's the most dangerous part. It's often used as a sleep solution. That nightly habit, something that feels harmless, is where the real damage builds. I've seen patients become forgetful, confused, slower in conversation. And when the medication is removed under medical supervision, some of that cognitive function actually improves. So ask yourself this: if something helps you fall asleep, but slowly harms your memory, is it really helping you? Now stay with me, because the next medication doesn't affect your brain first. It affects your kidneys, and you won't feel it happening. Ibuprofen, naproxen, Advil, Motrin, Aleve. These are the first things people reach for when pain hits. And for occasional use, they can be reasonable. But after 70, your kidney function has already declined significantly compared to younger years. These medications reduce blood flow to the kidneys, putting extra strain on tissue that's already aging. The damage builds quietly. No pain. No warning. Until one day, lab results show kidney function has dropped. Or worse, there's acute injury. And that's not the only risk. These drugs also weaken your stomach lining, increasing the chance of internal bleeding. They can raise blood pressure and cause fluid retention, which stresses the heart. So now you're dealing with three major systems at once: kidneys, stomach, and heart. Do you take ibuprofen several times a week? Because frequency, not just dose, is what makes the difference over time. Now let's talk about something prescribed specifically for sleep. Ambien. This drug gives the illusion of control. You fall asleep quickly, so it feels like it's working perfectly. But in older adults, it behaves very differently. It stays in your system longer. Which means when you wake up in the morning, you may still be sedated. Without realizing it. You feel normal. But your reaction time is slower. Your balance is slightly off. That's why research consistently shows a much higher risk of hip fractures in older adults using this medication. And here's something many people don't know. A hip fracture after 70 is not just a broken bone. It carries a serious risk of complications, including loss of independence, and even death within a year. And there's another issue. This drug doesn't improve the quality of your sleep. It reduces deep restorative sleep and increases lighter sleep stages. So you fall asleep faster, but wake up less restored. Which leads to continued use, higher doses, and dependency. It doesn't fix the problem. It reshapes it. Now the last medication on this list surprises almost everyone. Because it's prescribed all the time, and often taken for years. Proton pump inhibitors. Drugs like omeprazole, Nexium, and Prilosec. For short-term use, they're effective. They reduce stomach acid and help heal ulcers or reflux. But many people stay on them far longer than intended. And that's where problems begin. Your stomach acid isn't just there for digestion. It's essential for absorbing vitamin B12. Suppress acid long enough, and B12 levels drop. Low B12 can cause nerve damage, tingling in the hands and feet, and cognitive decline that looks very similar to dementia. At the same time, these medications can lower magnesium levels. Magnesium plays a critical role in heart rhythm and nerve function. When levels drop too low, it can lead to serious complications. So symptoms that seem unrelated, fatigue, numbness, brain fog, can sometimes trace back to a medication you've been taking for years without reassessment. Now let's bring this all together. The nighttime falls, the memory issues. The silent organ damage. These are not just signs of aging. Very often, they are medication effects. And they are preventable. Here's what you should do next. Write down every medication you take. Prescription and over-the-counter. Yes, even the ones you think are harmless. Bring that list to your doctor and ask for a medication review specifically using the Beers criteria. That one request signals that you want a safety-focused evaluation for older adults. Because the reality is simple. Your body has changed. And if your medications haven't changed with it, you may be carrying risks you don't even know exist. And this goes beyond medications. Some of the most dangerous combinations I see now aren't prescriptions, they're supplements people take every day thinking they're natural and safe. But some of those combinations are quietly increasing the risk of stroke, heart rhythm problems, and internal bleeding. And that's exactly what we're breaking down next.